Oh, okay, cool. So we have just started recording the webinar. Welcome all to the webinar on science, technology, and innovation for the SDGs and recovery from COVID-19. I'm really honored to be able to be your moderator for this session. So before we begin, just a few announcements and reminders. The call is being recorded. And just before everything, I will be asking all participants to keep your microphones muted all the time. If you are not speaking on that session, please turn off your camera. If you are not a speaker, please turn off your camera. If you are seeing yourself, this means your camera is on. So I will kindly ask you to turn it off because it can be disturbing for the others that are following the webinar. If your mic is showing in gray, if the icon of your mic is showing in gray, this means that it's turning on. So please, it needs to be showing as a red icon. So please do keep your microphone and camera off all the time. And we will be monitoring this as well during the call. And this is for all the speakers. If we notice background noise, please, you can do a pause. We will identify the source. We will be turning off the microphone of this person, and then you can resume your intervention. We invite all participants to use the chat box while they are attending the webinar. You can share contributions, you can share questions, you can share suggestions and recommendations. We will be using the chat box also for the summary of this session. And I want to remind everyone on the call, if you are on Twitter, we will be tweeting through the account @susdev, and the hashtag is #Tech4SDGs. So we will now be moving to the welcome remarks. And without further ado, I would like to invite Mr. Alexander Trepelkov, Officer in Charge of the Division for Sustainable Development Goals at UNDESA, for his remarks. Alex, please, you have the floor, and I would also invite you to please introduce our next high-level speaker. Thank you very much. The floor is yours.
Thank you, Nayara. Excellencies, distinguished participants, dear colleagues and friends, ladies and gentlemen. It is my great honor and pleasure to open this webinar on science, technology, and innovation for the Sustainable Development Goals and recovery from the COVID-19 pandemic. Thank you all for being with us today. The United Nations Department of Economic and Social Affairs has convened this webinar to share and discuss some perspectives on how STI can be most useful in dealing with the COVID-19 pandemic, as well as for accelerating progress towards the SDGs. This dual-purpose effort can only succeed to ensure double dividend results through engagement with multiple stakeholders across society and across the world. Indeed, it is more essential and timelier than ever to promote multi-stakeholder cooperation towards a sustainable recovery from the current crisis and building back better for sustainable development in a longer term. As you all know, the United Nations set up the technology facilitation mechanism as part of the 2030 Agenda for Sustainable Development, in view of the critical importance of STI for achieving the SDGs. Due to the pandemic, the 2020 Multi-Stakeholder Forum on STI for the SDGs has been postponed. Nevertheless, in response to the call by the President of ECOSOC for online stakeholder consultations on STI for the SDGs, this webinar, as part of this process, will help inform the ECOSOC High-Level Political Forum on Sustainable Development to be held next month. Even though this virtual format has some limitations, we expect that our conversations and discussions will continue beyond this webinar and lead the way towards transformative changes we need. On this note, it is my great pleasure to invite Mr. Liu Zhenmin, Under-Secretary General for Economic and Social Affairs of the United Nations, to deliver his opening remarks. USG Liu, the floor is all yours.
Thank you, Alex. Good morning, good afternoon, and good evening to all. Distinguished participants, my dear friends of science, technology, and innovation, ladies and gentlemen, I'm pleased to welcome you to the webinar on science, technology, and innovation, or STI, for the Sustainable Development Goals and the recovery from COVID-19. This is a part of a series of online consultations on STI for SDGs and COVID-19. It aims at providing key inputs to review of the SDGs at the forthcoming High-Level Political Forum on Sustainable Development in July. In this virtual conference room, I recognize some familiar names of participants from governments, the private sector, and the major groups. You have all worked tirelessly on the 2030 Agenda for Sustainable Development. I'm sure we are also reaching out to many new STI friends, practitioners, technologists, innovators, business professionals, and civil society representatives. A warm welcome to you all. Dear colleagues, we all understand the importance of science, technology, and innovation in our day-to-day lives and the ways in which they are transforming the world. If this was not clear earlier, it is blindingly obvious now in the time of COVID-19 pandemic. Science, technology, and innovation are indispensable for our response to and the recovery from the current crisis. Equally important is our collaboration in this great effort. Our experience with STI for the SDGs has convinced us that it is only through multi-stakeholder and multilateral cooperation that we can truly accelerate progress and reduce inequalities. Yet, while critically important, STI alone won't help us achieve SDGs and recover from COVID-19. Equally important are deployment of scientific inventions, innovations, and technology solutions on a scale that will reach their target audience. And this is not just another scientific task. It's where policymakers, entrepreneurs, business people, financiers, diplomats, and civil society come together in partnership. Distinguished participants, the President of Microsoft invited all interested policymakers, scientists, engineers, innovators, entrepreneurs, and organized science communities to engage in online consultations in preparation for the STI components of the High-Level Political Forum on Sustainable Development next month. In this context, this webinar will discuss improving the impact of STI on the SDGs, universal access and the use of vaccines, technology solutions and innovations for COVID-19 recovery and SDGs, and other exciting STI initiatives. This is an important agenda, but also a vast one. And the time available to us is limited, but we have also heard from you through your responses to our online survey. Your inputs are much appreciated. Ladies and gentlemen, I believe that by participating in this webinar, we are in the right place and the right time. Together, let us accelerate the exchange of ideas and the scaling up of good practices. I'm especially pleased that discussions and activities here will inform the High-Level Political Forum next month. I encourage all of you to attend the STI session during the high-level political forum, which will take place on July 10th, and related STI side events. I'm confident that you will find new ideas, fresh energy, and novel partnerships to sustain your efforts in support of the SDGs and the recovery from COVID-19 through science, technology, and innovation. I wish you all a very successful webinar today. I thank you.
Thank you, Undersecretary General. I'm now pleased to turn the microphone to my colleague, Mr. Shantanu Mukherjee, Chief Integrated Policy and Analysis Branch, Division for Sustainable Development Goals, the United Nations Department of Economic and Social Affairs. Shantanu, the floor is yours.
Thank you, Alex, and hello, everybody. I think the main purpose of our meeting has been made very clear already. So let me just say a few words about the technology facilitation mechanism under the aegis of which this meeting is being held. This is the multi-stakeholder body that was set up by the 2030 Agenda for Sustainable Development to ensure that science, technology, and innovation were deployed optimally for solutions to all the SDGs. So by definition, we try here to engage with all stakeholders who are involved in solution application, solution development, and solution dissemination, whether this be in the form of knowledge or technology, whether this be with traditional forms of technology or emerging ones, whether this be through global discussions or through country-level action, for example, through our work on science, technology, innovation roadmaps for SDGs. For all of you who are interested in our work, I invite you to visit our website at sustainabledevelopment.un.org/DFM, and I encourage you to get engaged. The primary purpose of our meeting today is, of course, to support in a substantive way discussions at the high-level political forum later this year, but I would also like to acknowledge the about 200 odd responses we have received to our survey, which complement what we will discuss today, and also the over 300 applicants who submitted innovations for the SDGs, which were carefully screened and graded, and you will be seeing two of them later today. So our purpose today is to give you a flavor of the multi-stakeholder and substantive collaboration around science, technology, and innovation for the SDGs. And we hope this will not only generate a useful flow of information and knowledge, but also encourage you to stay engaged in this endeavor with us. Thank you very much. Over. Naira, would you be taking over now?
Yes. Thank you very much, Shantanu. For our other brief remarks, I would like to invite Mrs. Shamika Sirimane, Director of the Division on Technology and Logistics of UNCTAD. Mrs. Sirimane, you have the floor.
Thank you. Excellencies, distinguished delegates, ladies and gentlemen, it has become clear that the response to COVID-19 and its aftermath demands a dramatic strengthening of research, capacity building, innovation, and technology transfer. International cooperation in STI that leaves no one behind are more than ever a matter of life or death. Mr. Liu emphasized this already. A significant aspect of global cooperation is support through open science and data for sharing scientific publications, research collaboration, and technology designs. As my colleague Shantanu mentioned, the call by the UN Interagency Task Team for Technology Solutions for tackling COVID-19 is an excellent example. In fact, at UNCTAD, we received over 70 submissions. As Shantanu, we have sent it to you. This pandemic has also shown that we need to improve the science policy interface at the national and international levels. Where this pandemic has been tackled well, there was always a coalition of science advisors and economic policy advisors working together. This should be the norm and not the exception going forward. In fact, this was the message of the CSTD, the United Nations Commission on Science and Technology for Development, that just finished the high-level segment of its first virtual meeting. Ministers called for a systems approach for policymaking. We heard from STI ministers from across the world about impressive efforts that countries are deploying to use STI to address the pandemic. We also heard about the huge challenges that lie ahead in securing medicines and personal protection equipment and lack of national capacity to build these PPEs, and the need for international solidarity in STI to address the current crisis and also to achieve a sustainable recovery. So for this, developing countries need to be involved more meaningfully in global decision-making processes that define how STI and particularly frontier technologies such as AI and gene editing are applied to the common challenges the world faces. This obviously applies to the fight against COVID-19, but it will be critical if we want to be effective and consistent with UN values in dealing with other challenges that are no less urgent and vital for humanity. So, and with this food for thought, I would like to wish you a fruitful discussion for today. Thank you.
Thank you very much, Ms. Sirimani. So we have just ended the brief and introductory remarks of our webinar. We have 2 sessions, including discussants for this webinar. I'm just showing the slides with the agenda. And so you see we have a very packed agenda, and we will just start the first session. So for the first panel, Science, Technology, and Innovation for the SDGs and Covid-19, we have 2 speakers on this panel, and I will be kindly asking all speakers to keep to the 5 minutes limit that we have indicated. I will be showing you a sign whenever there is 1 minute left for your intervention, so you can wrap up. Without further ado, let me invite Dr. Kenji Shibuya, Professor and Head of the Institute for Population Health at King's College in London, and Senior Advisor to the Director General of the World Health Organization. Dr. Shibuya, you have the floor.
Thanks very much. Hello, everyone. I'm an academic specializing in population health and global health policy here at King's College London. So today, I'd like to argue that fixing market failure through corrective actions in global health has made substantial progress since 2016, but the government failure is becoming a major concern in the current response to tackle COVID. In 2016, when I was an advisor to the Japanese health minister, the G7 summit in Japan had mobilized the momentum to tackle global health security because there was, it was aftermath of the Ebola virus outbreak. At that time, the world was kind of united to revamp the global health security architecture, including strengthening WHO's health security response, establishing the pandemic emergency facility at the World Bank, which is pandemic insurance, and also the establishment of CEPI for pandemic vaccine R&D. In terms of WHO, a new emergency response department was established, and a joint monitoring with member states, WHO, and third party was in place, and the international health regulations to assess the extent of preparedness and responsive capacity for a pandemic. Because previously, the monitoring was only based on the country self-reporting, and whose priority was questioned. So this was particularly obvious at the time of H1N1 pandemic in 2009. So the so-called joint evaluation or emergency, abbreviated GEE, was in place since 2016, and the detailed assessment of preparedness was well established. But if you look at the recent responses against COVID and the consequences of it, those countries with excellent preparedness do not necessarily mean that they are good at implementing. So this GE clearly suggests the importance not only the preparedness and the correct fixing market failure, but also we may need to tackle the government failure aspect of the COVID response. So as you know, classically, the basis of global corrective action for pandemic can be justified because of classic market failure. externalities and public goods argument. And obviously, COVID is a really good example. But also, COVID has revealed not only the fundamental market failure in global health, but also the government failure in global health responses. So today, I'll just focus on two examples on science and technology and innovation with respect to the global COVID response, notably vaccine development through SEPI, and of science knowledge sharing through publication. First on COVID vaccines. So since 2016, we have established, as I said before, the mechanism to fix market failure in the pandemic. One good example was Coalition for Epidemic Preparedness Innovations, SEPI, which was established in 2017 after the discussion at the G7 Summit in Japan in 2016. So we had a WHO. We haven't had WHO to set norms and develop a blueprint for which vaccine to be developed. And obviously, Gavi has been instrumental to deliver the existing vaccines. But it became clear that we didn't have enough capacity to invest in R&D for pandemic vaccine because there was no incentive for a single country or company to invest in this. So SEPI was established, and whose primary focus was on the later stage vaccine development. And currently, SEPI is investing in 9 COVID vaccine candidates, out of which 4 are in clinical trials. So which is SEPI is doing very well in the midst of this global politicized COVID response. And it's a good example of concerted effort. Why SEPI has been so successful right now? But first, I think SEPI was successful because it focuses on the gaps in existing system. For example, as I said, WHO does norm setting and coordination, including development of R&D blueprint, and Gavi does enhancing delivery of vaccines. And last year, Gavi's vaccine summit was a great success, as you know. But unless there is vaccine, it is not so effective. So I think SEPI really fills the gaps between the two. So right now, the mixture of SEPI, Gavi, and WHO is a really good example of global collective action in innovation. So R&D and financing instrument and delivery and coordination, political coordination. And so overall, SEPI was able to fill the gaps in the existing system. Second, SEPI has been working with markets from the beginning, but also with regulatory authorities and employed interdisciplinary experts in the board and scientific advisory committee from the beginning, which has led to the effective way to enhance R&D from various angles. And finally, not least importantly, SEPI really harnesses not only big pharma, but also bioventures working in innovative technology in vaccines. Right now, many of the SEPI awardees in COVID vaccine candidates are mostly innovative bioventures in the field of genetic vaccines, vector vaccines, or platform technologies, rather than classic big biopharmas, and entities. And also, SEPI is harnessing the collaboration between bioventures and usual big pharmas. So along with the regulatory authorities, government, this diverse group of expertise has really harnessed the new ideas and innovations and gained the support from multi-stakeholders and developed a trust-based network of really good people across countries. So to me, trust is really the key factors of success. And the second example is a big. Sorry.
I do apologize, Dr. Shibuya, but we need to wrap up.
Okay. So just to touch upon the second example is a big uncertainty in science technology associated with COVID. So every day we have a huge number of publications in peer-reviewed journals, but a proliferation of reprints are also causing a good thing, but also major problem. So, okay, so let me just
Thank you so much. And I'm really sorry about that, Dr. Shibuya. Please do feel free to tap into the chat box any links or resources or guidance, as I know that our participants are quite interested Thank you again. So moving forward, I would like to invite Dr. Regan, Senior Director at the National Academies of Sciences, Engineering, and Medicine for his intervention. Dr. Turekian, you have the floor and you have 5 minutes. Thank you.
Thank you. And it is, Excellencies, distinguished colleagues, and actually many dear colleagues, it is a great pleasure to have this opportunity to speak with this group and many of the people I know on the call for multiple times. In fact, just a month ago, I had the pleasure, and the National Academies of Sciences, Engineering, and Medicine had the pleasure of working with colleagues from the Israeli mission to the United Nations, the Mexican mission to the United Nations, and a number of other missions to the United Nations who co-organized what was something that could help fill the gap of, as was mentioned earlier, the fact that the STI forum for 2020 was canceled for the obvious reasons. And it also was telling that we were able to look at that opportunity to think innovatively in itself, how to use technology to, even if we didn't have the ability to have an STI forum, to bring people together, to think innovatively about how to bring together multi-stakeholder engagement around issues around science, technology, innovation for the Sustainable Development Goals in the time of COVID. I think that this is an example of on-the-fly innovation, which in many ways we should take as sort of a great credit to the fact that even as we are struggling to find approaches to one challenge, there are always and constantly innovations. I want to talk about a few issues, though, that came up. And one of them is quite clearly that what we are seeing and have seen is that there is little doubt that science and research are more critical than ever to addressing a global challenge and the global challenge of COVID. And that we are seeing this not only at the levels of the scientist cooperation, but also at research institutions and also at the private sector. There's my colleague Kenji was referring to a number of the vaccines. Well, if you look at the number of vaccine trials, there's a lot of multinational cooperation at the private sector level to begin to not only think about developing the
Mr. Regan, we lost you for a little bit.
Okay. So
yes.
I think, yeah, so this is back.
Yeah, you were back.
So it's probably when I was saying the most thoughtful thing that I was going to say, and the most, everything else I'm going to say is not going to be important. So whatever you missed was really the crux of what I was going to say. But I'll get back to the fact that basically we've got more and more science and research taking place at the grassroots and at the industrial sector to try to deal with COVID. COVID is clearly affecting progress towards SDGs. I look at any country and think of what happened about the numbers of people entering school or being in school, and you can see that as a result of COVID, most nations and most municipalities have to shut down their schooling. Well, clearly, education is a clear part of any SDGs. COVID, you can almost look across the SDGs and see that it's affected in a negative way many of the SDGs. And yet, one of the things I worry about going forward, and I know that we've had this conversation, is that as nations necessarily have invested huge amounts not only in the research around COVID, but critically also in the economic support systems that are needed. What we are going to see going forward is actually a decrease in the amount of money that will be available for the research and the science and the technology from the public sector in investing in science and technology for the broader set of SDGs. So even at a time when we are investing large amounts of money to deal with research around the world for COVID, we're going to see a limiting in the future because of other deficits that have to take place necessarily to support economics, again, part of the SDGs, but that's going to have implications for science, technology, innovation investments from the public sector, which makes much of the conversations that my colleague had just before me about engaging with the private sector more important, because that's where there's going to need to be capital moved. It clearly is also, as we're seeing from this and other things, COVID has changed the way that we work together. We need to learn from this. What were the technologies that we've been able to utilize, like video conferencing, and what are the gaps that exist? In some ways, we've become more inclusive because we don't depend upon meetings having everybody in the same room at the same time and traveling from far distances at great cost. But still, we recognize that much of the infrastructure, particularly around digital, has still maintained a great discrepancy between those countries and those places where there's access to broadband and high-speed internet and those parts of the world where there isn't and hasn't been. And if we're going to have a truly inclusive sustainable development goals approach, if we're going to leave no one behind, then we need to find ways to develop better and better infrastructures so that everyone can participate in these activities. We can be more broad in the efforts around technology, even as the systems themselves are changing. So let me just finish with this. I tend to be an optimist, and I know that we have a decade until we've reached the SDGs. If I were to give the warning, and the place where this forum and these bodies are going to have even more importance, is to keep knit together a global scientific community supporting the SDGs. Because even before COVID, there had been a tendency towards moving away, towards greater decoupling and isolation that was taking place among countries, nationalism and populism on the rise more broadly. COVID in many ways has shown the value of the scientific community coming together, but it's also shown the risks, what happens when countries are having to focus on not only a global pandemic, but a global pandemic that's affecting them locally. And the shutting down of borders and the shutting down of systems that will continue even as countries try to grapple with opening is going to be a really serious question about how does the global research and scientific community work in that environment, accentuated by other forces that are also making that kind of cooperation more difficult. So we need to look to these bodies, whether it's CSTD, US STI Forum, all the different bodies like this, to find ways to keep that communication open, even as we move beyond COVID and focus over the next decade of action. Thank you very much.
Thank you very much, Dr. Turekian. We have now two discussants on the theme of the first panel, Science, Technology, and Innovation for the SDGs and COVID-19. Each one will have 2 minutes for their comments. And again, I ask you to keep to this limit. I would like to invite Mr. Stephen Béraud, Deputy to the Director of the ITU Telecommunication Development Bureau, for his comments. Mr. Béraud, you have the floor, please.
Thank you, Ms. Costa. I'm delighted to join this webinar and have listened carefully to the comments made so far. For us at ITU, as the UN Agency for Telecommunications and Information and Communications Technologies, we recognize the need to join forces with partners to overcome the challenges and emerge stronger after COVID-19. ICTs are a major transformational factor in social and economic development, and they've demonstrated the potential to leapfrog existing technologies and to promote inclusive development. Even closer to home, science, technology, and innovation has increasingly become an influential force in driving progress that the world has witnessed in recent years. The SDGs, by their very nature, are interlinked and multidimensional, and ICTs have a critical role to enable bringing them together for implementation. COVID-19 is the first pandemic in human history where information technologies and social media and other connected, electronic connected services are being used on a massive scale to help us cope with and respond to COVID. The pandemic has highlighted the fundamental importance of ICT to the economy and to society as a whole. From teleworking and e-commerce to telemedicine and remote learning, ICTs are supporting continued access to the workplace, to education, to healthcare, and to essential goods and services. As businesses, institutions, and individuals battle with COVID-19, which has compelled self-isolation in homes and shutdown of workplaces, ICTs and telecommunication networks continue to provide continuity of activity. It is evident that harnessing and enhancing our ICT infrastructure, tools, and services, and our knowledge about ICTs is the key to making the response to COVID-19 and any future pandemic more effective and decisive than would otherwise be possible. The ITU is mandated by its members to facilitate the connecting of the unconnected. And we've heard from those who spoke before me about the importance of maintaining this connectivity. The ITU works with governments and other partners to help develop telecommunications, ICT, and broadband network plans, and to direct attention in the area of ICTs, as these governments do for other pressing agenda items, such as education, health, national infrastructure projects, and electricity grids, which now more than ever rely on ICTs to make them function. It is in this context, as soon as the pandemic began to have an impact on lives, ITU initiated a number of activities to support countries and their communities so that ICT networks can continue to provide that critical support in enabling the global community to cope with COVID-19. Our first major initiative, and perhaps the one I want to focus on, is
I'm sorry, Mr. Berho, you have to wrap up, please.
Okay, so I just wanted to mention our Global Network Resiliency Platform, Reg for COVID, which is a platform to bring together national policymakers, regulators, and other stakeholders to ensure that networks are kept resilient. And I think this is a key focus in assisting us in coping with COVID moving forward. Thank you.
Thank you very much, Mr. Behoy, and I'm sorry for that. Again, I really invite our speakers to use the chat box to share the links and information, because I've seen that participants are sharing a lot there. Let me move to our next discussant, Mr. Marcus Voltran, Program Officer at the Office of the Director at the United Nations Office for Outer Space Affairs. Mr. Voltran, you have the floor and you have 2 minutes. Thank you.
Thank you very much, Ms. Costa. Thanks a lot for the invitation. It's a real pleasure to talk to you today. I think we have heard it already in the beginning, and I think this can be summed up by the words of the Secretary General, which has put it out as, this is time for science and solidarity. And we from UNUSA would add, because we cannot address the defining challenges of our time and move to an informed decision-making without understanding the challenge. We cannot move forward without expertise and knowledge. And obviously we cannot come back and recover and cannot come back stronger without bold strategies and out-of-the-box approaches. And that's actually where the value of space programs has shown great benefit over the past months. I would like to highlight just a few things, such as identifying affected areas, disease modeling, transition monitoring, contact tracing, remote work, telehealth, communication, all of these examples. And I'm going to put afterwards a link into the chat function where we have, as the Office for Outer Space Affairs, have put together different approaches of how space technology has become important over the past months, and how the value has been shown over the past to address the current challenge. On the other hand, I think that we all can agree that space has become more affordable than before. New stakeholders are there, new technologies are developed. And so we from the Office for Outer Space Affairs try to make everything happening that we can guarantee access to space for all, because much has to be done to bring the benefits to everyone everywhere. So with the UNUSA initiative, for example, on access to space for all, we can address multiple and different SDGs. So we are putting the benefit of space technology to everyone everywhere. And with that, we address SDG 9, SDG 10, SDG 17 obviously is at the center of the access to space for all activities. Because for us, it's important to highlight that the recent study showed, which we did, that around 40% of the SDG targets are reliant on space technology. And over 50% of the essential climate change variables are dependent on space technology. So to sum up and to summarize, I think it's important to underline that we should not use only space technology to addressing the current situation, but as well use it in the future to recover better. And for that, I think it's just the three main elements which we have heard before as well in all the statements. It's partnership, networking, and cooperation. And we, as the Office for Space Affairs, stand ready to reach out to you and work together with you to address the current and the future challenges. Thank you very much.
Thank you very much, Mr. Voltran. And again, please do share the links on the chat box. We are now moving to our second panel, Technology and Innovation Solutions for the Decade of Action. We have 4 speakers on this panel. And again, I would kindly ask all of them to keep up to the 5 minutes. And unfortunately, I will have to interrupt you if you go further than that. The first one I would like to invite is Mr. Alessandro Marcello, Group Leader on Molecular Virology at the International Center for Genetic Engineering and Biotechnology. Mr. Marcello, you have the floor, please.
Yes, good afternoon, everybody. I'm a virologist, as mentioned before. I'm working at the International Center for Genetic Engineering and Biotechnology, which is an international organization where 80% of the staff are actually scientists doing research in different fields of interest, from infectious diseases to cardiovascular diseases, cancer, crop improvement, biofuels, etc. We are distributed, so our labs are distributed in 3 components. One is in the headquarters are in Trieste in Italy, and then we have a major laboratory in Delhi in India and in Cape Town in South Africa. and a vast network of regional research centers, including the one in Taizhou in China, and affiliated laboratories in over 65 member countries. Our mandate is to provide a center of excellence for research, training, and technology transfer in the field of biotechnology to promote sustainable development. Our activities are basically training of scientists from our member states, grants, activities, meetings, and technology transfer. During this COVID emergency, being a virology based in Italy, I've been also coordinating the COVID response of our center. And this response moved along different lines. First was to support our local health authorities in Italy to face the emergency by supplying diagnostics and isolating and sequencing the virus circulating in northern Italy. We actually provided the first sequences in the country in northern Italy at the time. And then, of course, the second line of activities to support our member states by providing reagents and know-how for the detection of the virus in order to promote local capacity in facing the emergency through an open online platform of COVID reagents. This platform includes tutorials for protocols for diagnostics as well as reagents for real-time PCR and for serology that would allow the setup of the assays in each member state without the use of commercial kits, which is a critical element in being able to perform these analyses. In the long term, we are also developing handheld devices or portable devices for virus detection. Another activity, important activity that we are working on is to support our member states to develop antiviral drugs against SARS-CoV-2, so the virus. As an example of public-private partnership towards the development of antiviral drugs, we actually collaborated closely from Italy with the Indian Sun Pharma Industries company to test their plant-derived, from the traditional medicine plant derived phytopharmaceutical drug for the treatment of SARS-CoV-2. And actually this week, clinical trials are being initiated in India on COVID patients. You know that India is experiencing now actually the phase of major growth of the pandemic in the country. And they are starting clinical trials with these drugs that we tested in patients, and the results will be available soon. So to conclude my intervention, I would like to highlight the importance of having an international network of scientists, people who actually do science, to allow rapid spread of essential tools and resources to face any pandemic as quickly as possible. So I thank you for your attention.
Thank you very much, Dr. Marcello, and also for the very hopeful messages that you brought. The next one is Mr. Jean-Pierre Caillol from the Departmental Program Coordinator for the Department of Nuclear Sciences and Applications of the International Atomic Energy Agency. Mr. Caillol, please do indicate whenever you need your slides to be moved, and you have the floor.
Thank you very much. And it's a great pleasure and honor for me to represent the agency here for this webinar. I have a presentation, like my colleagues before me, so bear with me. I'm trying to stick in the 5 minutes. So briefly, if you can move to the next slide. I'm going to give a quick review of what the IEA, the International Atomic Energy Agency's response to the COVID-19 has been. So under the conditions of the pandemic, we've been approached by 121 to date countries and territories. We have 174 member states right now, if I'm not mistaken. And the reason for approaching us, our main technology was the knowledge we have acquired in the animal sector with the use of the reverse transcription polymerase chain reaction. which we use to detect viruses in animals. So this is where our expertise is through our joint division with the Food and Agriculture Organization. So we've got these requests. We received contribution from member states and donors, and we have provided most of the assistance through our technical cooperation program, which is our main arm for technology transfer and delivery assistance to countries. We had over 250 laboratories that were registered by the member states. To date, these are the numbers from yesterday. We sent 168 sets of RT-PCR and diagnostic kits. That represents about a bit more than 1,100 purchase orders issued. But then on the same side, at the same time, we had to adjust to doing things differently. Of course, shipping was the main issue, so we worked also together with the World Health Organization. The IEA became part of the COVID crisis management team. We worked hand in hand with the Food and Agriculture Organization, also through our joint division. But we had to find a way to pass the information to the member states, to the technical people. So we had webinars on different subjects related to health. Some colleagues also had courses and guidance on how to operate nuclear power facilities under the conditions of COVID. The nuclear safety was important. The webinars that we managed, we had total 8,000 participants, so we're pretty happy. And overall, today we spend over 13 million euros. This is one of the main projects. This is the biggest project the agency ever managed. If we can go to the next slide, please. So what did we learn from the outbreak or the pandemic of COVID-19 and others? This is what I call, for me, it's a perfect example of what we call the butterfly effect. I mean, for one of the first time, we see exactly what is the butterfly effect. So we basically realized that something happening on the market somewhere in China, a person buying or purchasing some meat or some sort, has in a few weeks such an impact on the economy worldwide, on the life of people being at home, and unfortunately causing the number of deaths we've seen today. I think the public have realized that scientific knowledge, scientific data is very important. And the importance of the different zoonotic diseases, the role of zoonotic diseases. Next slide, please. So the approach was the future. We need to be able to do as much as we can to prevent the outbreak rather than to control a pandemic. And these are the different areas we're currently investigating. At the center, and I've heard that through several presentations before, coordination, integration is the key. We have to work together. We all have different expertise. We have private sector, we have national authorities, we have regional authorities, we have the UN. We all have different roles. Here, in all of these different aspects, in surveillance, what we're investigating is the possibility of tracing the origin, going back to the origin of the virus at the interface between the wildlife, domestic animals, and humans, monitoring the virus mutation, the detection, being able, all of those different aspects rely strongly on research and development. And access to the decision-making tools using GIS, using satellite information, and of course, building capacity in the countries. And I'm going to stop there. I see that you had the sign. Thank you for your patience. Thank you.
Thank you very much, Mr. Payal. So we are moving to our next speaker. I'd like to invite Mr. Naveen Bali, Chief Operating Officer at the Banpu Health. Mr. Bali, you have the floor.
Thank you. This is Naveen. Hi, good morning, good afternoon, and good evening. At the onset, let me thank you for this lovely forum and interaction and giving us the opportunity to present and introduce our innovation. Next slide, please. Globally, about 130 million babies are born every year. About 1 million babies take their first and last breath on the same day. Add another 1.5 million babies who die during their first month of the birth. This adds up to a staggering 47% of children deaths below the age of 5 years. Majority of these deaths are preventable. At Bamboo, our vision is for all children to have a chance to live full and healthy life. To achieve this, Bamboo Health offers innovative, life-saving health products for children in low-resource areas. Our mission is to touch 2 million babies by 2025 and 10 million babies by the year 2030. Next slide, please. There are around 22 million low-birth babies born every year who are at risk of two top preventable causes of hypothermia and infection, which can cause poor growth and death. With the help of global funders, we at Bamboo have developed a unique innovative bracelet for continuous temperature monitoring of newborns in the community setting. The bracelet is given to low-birth babies before discharge from hospital. It sits on the baby's wrist for 1 full month and monitors the temperature. It blinks a soft blue light if the temperature is normal, and it blinks an orange light and beeps whenever the temperature drops below 36.5 degrees. We are fortunate to work with United Nations agencies, private healthcare providers, and governments around the world. Next slide, please. We have reached over 31,000 babies in 8 LMICs in our initial first 5 years of inception. We are fortunate enough to be recognized and featured by Time magazines in the year 2017 as one of the 25th best innovation. Next slide, please. We are working with UNICEF in 5 LMICs in Africa and Pacific region. The Temp Watch bracelet is studied in multiple hospital and community settings and have 9 clinical publications on endpoints ranging from accuracy, clinical outcomes, and weight gain, increase in KMC practice to acceptability and to a potential decrease in mortality. The device was evaluated by CDC Atlanta in Papua New Guinea during an implementation by UNICEF and Papua New Guinea government. Next slide, please. Apart from bracelet, we have developed innovative portfolio products to address apnea management, kangaroo care promotion, and facilitation. Our interventions are supported by USAID, Bill and Melinda Gates Foundation, GCC, and Saving Lives at Birth. Next slide, please. We look forward to connect and work with all other agencies to see how we can support the newborns around the world in this time and reduce the neonatal mortality, as we remain focused and committed to our mission to reaching 10 million babies by the year 2030. Thank you.
Thank you very much, Mr. Bali, including for keeping the time. Next, let me move forward to Mrs. Emily Cody, Director of Program Development at Peripheral Vision International. Mrs. Cody, you have the floor.
Great, thank you so much. My name is Emily Cody, and I'm speaking today on behalf of Peripheral Vision International on our COVID-19 prevention efforts. Next slide, please. PVI is an award-winning media innovation firm focused on improving lives in the developing world. Recipient of the 2000 MIT Solve Prize, our work has been featured in dozens of news outlets. Next slide, please. Vulnerable communities in remote areas do not have access to critical information on health urgently needed to make informed decisions about their lives. Existing interventions fail to acknowledge a lack of literacy, ability to transliterate to one spoken language, and limited financial ability to purchase a smartphone or other expensive devices. Next slide. Barriers to technology additionally occur across gender, ability, income, and geographic lines. Next slide. In response to these immense challenges, PVI developed Wanji Games, choose-your-own adventure-style games delivered free of charge through devices the majority of people can already access, a simple mobile phone. In March 2020, PVI launched games on COVID prevention incorporating World Health Organization guidelines. The games have since gone live in several countries. Next slide. The reach of Wanji is immense. Since its launch in 2017, the platform has scaled to 17 countries and received over 2 million unique calls. Next slide. We've worked with behavioral economists to assess in-game learning. An experiment conducted in Cambodia in 2019 demonstrated Wanji's ability to increase job-seeking confidence and planning intentions even after a single exposure. Next slide, please. Here you can see our most recent press coverage on Wanji's COVID-19 prevention games. And lastly, for more information, please see our website at www.pvinternational.org, and I'll also include that in the chat box. Thank you very much for your time.
Thanks very much, Mrs. Cody. So we are moving again, just reminding the speakers to leave the links also on the chat box so people can easily access the information. We have one discussant for this session, and I just want to see if he is connected. Mr. Douglas Regan, Program Management Officer Specialist at the Children and Youth Human Rights and Social Inclusion Unit of UN Habitat. Mr. Regan, are you on the call? Let me just double check. Doug? Yes. You are muted. Yes.
Hi. Sorry
Please
about
go ahead. You have 2 minutes.
Thank you. Thank you very much for having me here. I think, unfortunately, I've had some significant issues from Nairobi on technology for all intents and purposes. When we're looking at technology and the application to what's going on right now, especially in regards to COVID-19 and solutions for a decade of action, I think we really have to focus on how young people are first adopters of technology. We've seen this specifically in the informal settlements here in Kenya, but as well as globally, where young people have been able to utilize technology both for planning and organizing their communities, but also for the emergency response that's happened here in Kenya. For example, three teams of 50 young people have been going throughout the different slums in Nairobi, and they've been mapping all the different COVID-19 assets. So those would be water points, places for isolation centers and such. And I think it's been quite amazing, but also kind of almost a proof of concept when we're looking at what's happening. I co-chaired the DESA Interagency Network on Youth Development for two different periods over the last 15 years. And again, it always surprises me, and I'm always very impressed with how young people can apply these skills, the skills that they have in the area of ICT and technology, to making our world a better place. So I think moving forward, I think what we need to look at is how COVID-19 has, again, I think, highlighted or it made very clear that there's many inequities in the world, but I think it's young people and the people and those on the ground, especially in the global south, in which young people make up 60 to 70% of the population in many places, and it's informal settlements in which they are also in the vast majority, in which we need to look for them to moving forward and blazing the way forward around the use of technology. Thank you.
Thank you very much, Mr. Regan. So we are moving now to the interactive dialogue with some interventions from some selected speakers. When registering to attend this webinar, several participants registered their interest to make some short interventions. There are two main questions that will be addressed: how to strengthen multi-stakeholder cooperation to help address the current crisis, mitigate long-term impacts, and lead the way towards a sustainable recovery and prepare for future challenges. And then how to deploy and scale up the technology solutions for COVID-19 recovery. I have six colleagues and participants registered. I will be inviting you to speak as we go. And also, if there is time left, we will go back to the chat box to see if there are some questions that we can still address. My first speaker that I have is His Excellency Mr. Andrei Spildagovic, Permanent Representative of the Mission of Latvia to the United Nations. Ambassador, if you are on the call, you have the floor.
Hello.
Hi, good morning, Ambassador.
I hope you can hear me and can see me. Dear Undersecretary,
Yes.
We can hear you. I mean, the camera is a little further away, but we can hear you. Please do go ahead.
Yes. Dear Undersecretary General, dear hosts, distinguished panelists, let me extend my gratitude for hosting this webinar on a role that science and technology are playing in global fight with pandemic. COVID-19 has exposed global inequalities and digital gaps in health systems, education, good governance, and protection of the most vulnerable. Billions of people are going online to look for trustworthy information, to stay connected, and to keep studying. But almost half of the world's population still has no access to the information technologies. Therefore, the crisis hides a transformative power, and we should use the momentum to rebuild better. We need to reduce the digital divide and focus on those who are suffering most. We also need to immediately take action to cease spreading disinformation, and all our resources should be shaped by and in respect of the human rights. This pandemic has no boundaries. Therefore, one of Latvia's approaches was a timely preparation of all society approach. Government's decisions to curb the spread of virus were taken in close cooperation with medical professionals, private sector, academia, and members of parliament. Let me share just a few examples of the Latvian know-how in this regard. For many years, Latvia has developed e-governance system in order to ensure the continuity of everyday services provided by public and private institutions. Nevertheless, during the pandemic, a new digital voting tool, e-Parliament, was launched. Latvian Parliament was one of the first legislatures in the world who used such tools to work and vote remotely. Since the state of emergency was declared, our government encouraged entrepreneurs to start producing various types of personal protective equipment and technological solutions which could help to reduce the spread of virus. One of those products was an application called Stop COVID, which was created by a team of Latvian IT companies. Our data analysis showed that usually individuals are infected in their place of residence and work, and therefore only by limited physical contact it was possible to break the chain of infection. This application uses exchange of Bluetooth system, and it informs the users of he or she has been exposed to an infected person for more than 15 minutes in proximity of 2 meters. This COVID application is in full correspondence with GDPR requirements. It operates with respect to human rights and is compliant with the EU legislation. We have made similar e-solutions also to the education system to facilitate e-learning during the COVID crisis. And we stand ready to share Latvian experience in e-governance with other countries. I want to acknowledge that the fight is not over yet, and therefore Latvia is ready to share its best practices and these unique tools to support solutions, adaptations in other countries. Thank you.
Thank you very much, Your Excellency, for coming and for sharing this Latvian experiences. Our next speaker is Mrs. Anat Fischer-Zinn from the Permanent Mission of Israel to the United Nations. Mrs. Zinn, you have the floor, please.
Hi, can you hear me?
Yes, we can hear you.
Okay. So I would like to thank you for hosting this very important webinar. STI is a high priority for my country, and we, together with Ghana, were honored to be chosen as chairs of the STI Forum this year that unfortunately was canceled due to the COVID-19 pandemic. However, we felt that today more than ever, it is important to talk about the contribution of STI as well as STI solutions for the SDGs. So together with 9 other countries, USG Fabrizio and his Office for Digital Cooperation and the National Academies for Science, Engineering, and Medicine under the guidance and vision of Dr. Regan that you heard before, we initiated a digital conference on the role of STI in achieving the SDGs in the COVID-19 era that took place in May. I'm happy to share my insights from the conference, and for those of you who would like to learn more, I would be happy to share the link to the conference website. So my 3 main insights are, the first one is cooperation. STI, especially in the COVID-19 era, is a team effort that cannot be taken for granted in a time when COVID-19 sometimes causes countries to focus on themselves. We must work together if we want to find comprehensive solutions. And let's not forget that we also need cooperation between different disciplines and areas of studies. Second is accessibility. Since good ideas and innovation can come from anywhere, we must find ways to make knowledge accessible for everyone. And the last, speaking as a diplomat myself, is diplomacy. I think that today more than ever, COVID-19 has raised awareness of the importance of diplomacy and multilateralism in fostering STI and international much needed cooperation. Thank you.
Thanks very much, Ms. Sin. The next one on my list is Ms. Xiaolan Fu. Xiaolan Fu from Oxford University, and also apologies for my mispronunciation of your name. Are you on the call?
Yes, I.
So just 1 second, because you have been muted. You can go if something. Okay, go ahead.
Okay, yeah. Okay. Dear Chair, distinguished speakers and friends, thank you for having me for this important webinar. The COVID-19 pandemic has exerted a significant negative impact on the global economy. World trade and foreign direct investment could both drop by 30 to 40% this year, according to UNCTAD and WTO. We will see a subsequent fall in incomes, job opportunities, increases in inequalities, and millions of people may be pushed back to poverty. All this will further derail the global efforts to implement the SDGs. Looking forward to the post-coronavirus economic recovery, emerging technologies can play a transformative role in offering solutions to the challenge of great lockdown, enhancing the resilience of the global production system and supply chains, and fostering new drivers of economic growth. This is an action area where STI advices and economic policy interface meets each other. Firstly, innovative technologies have played an important role in the fight against COVID-19. Not only robot cleaners in hospitals, drone deliveries of medicines, food, and the contact tracing, but also telehealth, e-business, online education, online offices system have all grown rapidly. Secondly, some sectors, such as various e-business, have already grown rapidly during the increased demand. We will see new industries emerge in this reshuffle and relocation of the global value chains. Not only digital economy, but also sectors such as public health provision, they will all become new engines of economic growth and for recovery. And thirdly, digital transformation of existing industries will make the production process less affected by restrictions on human mobility and increase the resilience of the global supply chain. Therefore, digital transformations, including smart manufacturing, smart services, and the digitized green transformation supported by 5G, big data, blockchain, etc., will support the way towards a sustainable recovery.
Thank you very much, Mrs. Su. Thank you so much. Apologies for that. I will ask you to please post more information on the chat box. The next one on our list is Mrs. Sumaya Talib Yosef Al-Fraji from the Ministry of Agriculture of Iraq. Mrs. Al-Fraji, if I think I saw you on the call, you have the floor, please. Mrs. Sumaya Talib Yusuf, I see you are on the call. You are showing as muted. Okay, let me go to the next one while we try to sort the issue with Mrs. Yusuf connection. The next one, Mr. Luiz Augusto Galvão from Fiocruz in Brazil. Luiz Augusto, are you on the call?
Yes, I'm here. Can you hear me?
Yes, we can hear you.
Okay. So thank you very much, for this opportunity. I want to drive our attention to the importance of the experience we have during the COVID-19, that all pollution went down, and the goodness that represents for health and well-being of everybody. And that's something that we observed during the COVID-19, and we should keep it or try to keep it during the recovering phase of the COVID-19 activities, economic and social and transportation activities. So there are many calls out there. During the last week, WHO launched an important manifesto asking countries to pay attention on the recovery and looking to more maintaining the commitment for sustainable development, and also have these activities that can keep on all these important lower of contamination and making nature more available for people and for the health of the people. Also, the Health and Climate Alliance launched an important call for the G20, asking for taking action, not only in the COVID recovery of economic, but also looking to how that is an opportunity for climate crisis to be addressed during this recovery phase. So all this, if you can work together, and technology, science, and innovation will be fundamental for put together some important knowledge that people can use in this recovery phase to make it more healthier, the environment more healthier, and all the climate crisis being addressed for everybody. So that's the important message. I think environmental health will play an important role guiding this whole process, and also advocating for a better world, a more equitable world for everybody. So that's my message, and we at Fiocruz, with Dr. Gadelha, who is also on the call, is working together on this recovery phase, but also very committed with the vaccination and testing of Brazilian people, and very committed to science, technology, and innovation. Thank you very much for your time.
Thank you very much, Dr. Galvão. So let me try again, Mrs. Youssef. Let's see if we, yes, I think we can hear you now.
Yeah. Hello, everyone. And thank you very much to inviting me to the very important webinar. To help to deal with COVID-19 pandemic, I'm going to talk about the solution of the future challenges, which is the vaccine production. As a virologist, work on the production of synthetic gene vaccines against viral diseases, especially RNA viral disease. I want to talk about a very important phenomena that people suffer when they infect with RNA virus. It's antibody enhancement phenomena. All RNA viruses cause this phenomena. So we have to induce a novel vaccine that can tackle or prevent this phenomena, because vaccine will stimulate antibody against the COVID-19. Some studies have been done on rabbits, and they infected rabbits with MERS, and they show antibody enhancement phenomena. And when they infected the same rabbits again with the same virus, they will not show this phenomena. So we have to think or start inducing very low cost vaccine by using genetically modified bacteria like E. coli, or what we call it BET13. So what's the reason that lead to this phenomena? So phenomena will stimulate neutralizing antibody. This neutralizing antibody, called negative immune response, will attach to the virus but will not neutralize the protein of the virus, and the virus is still active and is still virulent. And this neutralizing antibody will help the virus to be inside the macrophages, inside the monocytes, and these immune cells will not recognize the virus as an antigen, as a strange body, so will not kill him, will not analyze him, but will let him to go again to the blood. So the next step is how to induce very low-cost vaccine. I work on this vaccine at Australia, but not on a COVID, another RNA virus. And we have to use vaccine that block the neutralizing antibody. If we design any type of vaccine, this vaccine will not work because it will induce neutralizing antibody. So there is a specific type of vaccine. It's a synthetic gene vaccine. We have to convert RNA virus to DNA virus, and we design a synthetic gene. And thank you very much.
Thank you very much, Mrs. Yosef. Our final intervention that we have is Mrs. Cornelia Zinova from UNESCO. Mrs. Zinova, if you are on the call, you can unmute yourself, and over to you.
For giving me the floor to share with you a brief statement from UNESCO. In line with its mandate, UNESCO's response to COVID-19 focused on ensuring access to education, placing culture in the service of innovation and social cohesion, and ensuring the access to free, reliable information. And from the outset, it was clear that none of these actions can be undertaken without science, technology, and innovation. The application of STI is vital to fight the current crisis or any other current or future global threat. Timely and open communication of scientific information and data allow the scientific community to
Apologies, Cornelia, if you could keep your mic very close to your mouth. You're breaking a little bit.
Yes, thank you very much. The application of science, technology, and innovation is vital to fight the current crisis or any other current or future global threat. And timely and open communication of scientific information and data allowed the scientific community to break graphical and disciplinary barriers and advance with unprecedented speed in helping understanding and addressing the threats to humanity. And it also allowed policymakers to take evidence-based decisions and empowered citizens to implement evidence-based solutions. So looking forward and learning from this crisis, at UNESCO we see urgent need for international concerted action in 5 areas, and for which the technology facilitation mechanism gives us already great cooperation opportunities. First, reinforcing international scientific collaboration and ensuring equal representation of scientists from developed and developing countries. Second, ensuring long-term investment in strengthening national STI systems across the globe. Third, reinforcing the science policy society interface, including through science diplomacy and mechanisms for evidence-based decision-making. Fourth, promoting the culture of science broadly. And finally, transition to open science globally. And on this last point, I would like to share that UNESCO, with the contributions from all the partners and stakeholders within and beyond the UN system, is keen on pursuing its action on building a global consensus on open science by developing a global recommendation on open science to be adopted by all UNESCO's member states in November 2021. Thank you very much.
Thank you very much, Mrs. Tizinova. So we do have a few questions. I saw that the chat box has been very active. I wanted to check if Dr. Shibuya, if you are still on the call, there is one question that perhaps you can address. And just check if you're still on.
Sure, which one?
Awesome. Okay, I will read it. besides the relevance of CEPI, Gavi, and WHO, highlighted by you, access will be crucial to these technologies, such as vaccines. WHO has recommended that this should be dealt in terms of humanitarian commitment. There are important resistance to this recommendation. Do you have any comments on this issue, Dr. Shibuya?
So I think I agree. So there is a growing argument for fair, equal distribution of it. So also one of the efforts done by Gavi recently was to develop, for example, to reduce the price of vaccine by establishing innovative financing mechanism, which is called COVAX AMC, Advanced Market Commitment, to give incentive for the manufacturer to supplement R&D costs by global community to reduce the price of vaccine. So I think there are growing argument to support for fair distribution, and one of the most important agenda for the global community. What would be the mechanism to enhance that? And so I think there is an effort being done to different entities and stakeholders.
Thank you very much, Dr. Shibuya, for that. There is another question here. I'm wondering if Professor Turekian, if you're still on the call, and perhaps Shantanu, if you could have ideas on this one. The question is how the poor people and home-based workers will survive in this situation. The person is speaking in the context of countries like DRR and Bangladesh. Do you have any idea on technology and marketing for them in this period? And then the person is saying because they do not have any work or any other order to supply or sell at this moment. So I wonder if there are any insights for poor or developing countries. Just wondering if Dr. Turekian, if you want to address this one, or perhaps Shantanu.
I think Shantanu might be better placed on this one.
Thank you, Dr. Turekian. Shantanu?
Okay, this is a critical question and very difficult because essentially the responses to COVID in many countries have meant a stop to the kind of economic activities the poor are engaged in. So it's hard to make some general recommendations here, but I would just like to offer 2 or 3 thoughts for countries that are following this. The first step, of course, is that in the very short term, there has to be some kind of support to the incomes lost and the livelihoods that have been put on hold. And this primarily is the function of national governments, but of course, the UN humanitarian agencies also play a strong role. So one cannot get away from this. The second step is that as the economies restart in some way or the other, I think there has to be special attention to making sure that these kind of jobs that the poor people do or the livelihoods they obtain, first, they are connected to a viable market, number one, and number two, that it is safe to resume these occupations. So I think here, again, there is shared responsibility, not just from government, but also private sector and other stakeholders. And there's a shared responsibility of accessing some of these markets, which may now be global rather than local, through some of the platforms that Charlene mentioned, which actually specifically market products from developing countries to developed countries. So I think there are technologies that are possible and can help here, but clearly this has to be a much broader effort than just saying we need to have access to internet or something like that. A lot of actors have to come together. Thank you.
Thanks so much, Shantanu, and perhaps you should keep your camera on because unfortunately we need to move to the closing remarks, and I want to invite Shantanu Mukherjee, Chief of the Integrated Policy and Analysis Branch of the Division for Sustainable Development Goals at UNDESA, for his closing remarks, and then we'll be ending the call very soon. Shantanu, over to you again.
Thank you, Naira, and first of all, I would like to thank all of our esteemed speakers and guests, and most particularly everybody who has participated in this call, in this webinar, for contributing so much through your experience, through your thoughts and your knowledge. Thank you. It's one of the aspirations of the technology facilitation mechanism to connect people like you across the world, and for us to be the conveyors or the platform through which this happens. As we talk about SDGs and COVID, I want to offer just 2 or 3 parting thoughts. First, even before COVID, the SDGs were actually not doing that well. We were off track on poverty, headed in the right direction, but off track. Off track on maternal mortality, again, decreasing across countries, but not fast enough to reach the goal. And absolutely not even on the right track on things like climate and biodiversity loss. So even before COVID happened, we were having these problems to contend with. On the other hand, as we look at the impacts of COVID and we think about the virus or we think about the economic steps governments have taken, surely it becomes clear that SDG progress itself conferred some kind of immunity to the worst aspects. So clearly, if there had been better progress in providing water and sanitation facilities to all, people would have been able to actually undertake the hand washing behavior that's recommended. If social protection systems had been rolled out properly as is required in SDG 1, there would have been better protection from job losses and livelihood losses. And if non-communicable diseases had been brought under control, the tendency of pre-existing conditions to complicate recovery from the virus would also have been curbed. So the point I want to make is that progress on the SDGs confers a great deal of immunity to things like COVID and the shocks that may be also occurring down the road. Finally, as we look to the recovery period, clearly if we recover and get back to the pre-pandemic path that we were on, where trade-offs between the environment or between nature and people or between social equity and people were not being considered, if we just get back to that recovery path, this will be the path of 2019, and it will not lead us to the SDGs. So as we think ahead and think of how science, technology, innovation is to be mobilized for multi-stakeholder collaborations, we have to be reinforced in our belief that reaching the SDGs is good for resilience. But when we talk about resilience or recovering better, we have to be on a path which is different from the pre-pandemic one. And I think this is where, as we look forward, as Dr. Turekian and others have urged the UN to do, this is where we can play a leadership role working with you to bring the solutions and the thinking needed, not just to get back on track where we were heading towards, but to actually get off of that track and move to something much more sustainable and equitable for all of us. Thank you so much.
Thanks very much, Shantanu. So this leads us to the end of our program. Again, for all your information, all materials and the recording will be posted at the website that was showing just before at this website. It will also be sent to all those who registered to attend the call. You'll be receiving an email with the links very soon. Again, I want to join Shantanu in thanking all the speakers and all the participants for your engagement in this webinar. And I want to also extend a special thanks to all the colleagues who coordinated and organized this call and supported the organization of this session. The webinar is now closed. Thank you and have a good day.
Thank you.
Thank you, Nayara. Thank you, Shantanu. Thank you, Wei. Thank you, Alex. Bye-bye. Thank you.
Thank you very much.
Thank you so much for your support. Great meeting.